The PIX 11 News at 5 starts right now.
Meantime, despite the breaking news, though, the mayor insists his deadly outbreak is under control. But the relationship between Mayor de Blasio and Governor Cuomo is more contaminated than ever. PIX 11's Mario Diaz is live in the Bronx right now with the very latest for us. Hi, Mario.
Hi, Tam. So, for quite some time, we have seen a power struggle develop between the Capitol in Albany and City Hall in Lower Manhattan. The latest example of it coming in the midst of this Legionnaires disease outbreak here in the Bronx, which, according to the city, officially has 115 cases connected to it.
It bothers me because this isn't about any individual politician and how they're handling their job. It's about making sure that the public is taken care of properly.
Dr. Ezriel Kornel is a neurosurgeon and assistant professor of neurosurgery at Weill Cornell Medical College. That is also his perspective regarding political posturing in the midst of a crisis. In this case, it's the Legionnaires disease outbreak in the Bronx. And those doing the political posturing in the eyes of many, Governor Cuomo and Mayor Bill de Blasio.
Politics should have nothing to do with this. The health department should be totally separate from any politics. There should be fundamental, routine ways of managing public health that have absolutely nothing to do with politics.
Dr. Cornell's work is focused on a different kind of posturing. He is a neurosurgeon who specializes on the spine. However, when he learned of the first death in the Bronx as a result of Legionnaires, it immediately forced him to reflect back to his early days in medicine.
It brought me back to when I was an intern in 1978 in Washington, D.C., and I remember taking care of a patient who had Legionnaires' disease.
Dr. Cornel successfully diagnosed and treated the first patient to survive Legionnaires' disease at the Washington Hospital Center in D.C. That period was filled with sleepless nights and uncertainty.
I stayed up day and night with him for over a week, literally day and night, to maintain his oxygenation as his lungs were barely functioning till they were able to start recovering. So I remember it pretty vividly.
Now, 37 years later, after treating thousands of patients, Dr. Cornel conveyed his memories of a case that continues to stand out.
He's one of the most prominent in my mind because it was so unusual and so difficult to treat.
Especially since the patient's body was ravaged by the disease and pushed to its limits.
There were times every few hours that we thought we might lose him. It was really an hour-by-hour problem for days.
Ultimately, the patient recovered, and the disease has rarely made news since, until the outbreak in the Bronx that has produced 12 deaths. The outbreak raising Dr. Cornel's concerns as a result of the times that we are in. To put it simply, this is 2015, not 1978.
I was concerned because since it's now a well-known disease, I was surprised that so many patients had already passed away from it.
And again, that death toll stands at 12 from this latest outbreak. I should note that during the midst of that story just now that you just saw, the mayor's office of New York City sent out an email to the media announcing that Governor Andrew Cuomo, Mayor Bill de Blasio, and New York City Council Speaker Melissa Mark Viverito have announced that the state and the city would take the unprecedented step of jointly crafting and instituting uniform regulations to combat Legionnaires' disease. So it appears that the city and Albany are now working together to get, obviously, this disease in check and basically force it to get away from this area here in the Bronx as well as throughout the city. One more note for you here, that the city will be holding a town hall. Public advocate Letitia James is set to have that town hall at about 6 p.m. this evening, just steps away from where I stand here in the Bronx. Reporting live from the Bronx, Mario Diaz, PIX 11 News.